great having you here. I enjoyed our office meeting. And one of the things that I find so refreshing about your nomination and the general approach to healthcare that I think the administration is taking, the Make America Healthy Again, is looking at the big picture before you dive into the details. And one point of emphasis of yours, and I know of others in the administration, is making sure that we get a hold of chronic disease more effectively. We have Americans that just for too long have not been getting the right care at the right time, and it makes our country unhealthy. And importantly, it also makes our health care a heck of a lot more expensive in the end. So if we just do things more smartly, as opposed to the way it's always been done because there are entrenched interests, we can make people healthier. And we can spend less money on the things that could be done a lot more efficiently. So I'm just going to ask you about prevention and chronic disease and what reforms, if confirmed, that you think we should make to existing federal programs that you'll have oversight over to include a stronger emphasis on prevention and early intervention for chronic diseases.
Senator Young, thank you for hosting me in your office. I went back and watched Hoosiers, by the way. And I would love to take you up on the offer to sneak into the Senate gym when the time comes, if I'm confirmed. The question you ask is fundamentally important to how we can make the money we're spending on healthcare work in America. I don't think spending twice as much as every other country is enough if we're more than twice as sick as every other country. And so the real question is, what's our obligation, each and every one of us? I think it is our patriotic duty to be healthy. First of all, it feels a heck of a lot better. It's the right thing for your family. You want to walk your daughters down the aisle. You want to do the things that age allows you, including being a wise arbiter of what's happening in society. But it also costs a lot of money to take care of sick people who are sick because of lifestyle choices. It's different if you're born with a defect that requires an operation. Often those are fixable issues.
Yeah,
but
people don't want to be liabilities, to your point. People want to be assets, and they want to realize their full human potential.
And if 3/4 of them can't serve in the military when they're young, how many are going to be vital when they're older? And I think this sort of culminates in the bigger messages. What do you have in your fingertips that you could do? One thing that CMS can do is incentivize wiser moves. As an example, in Medicare Advantage, most beneficiaries have some type of a food allowance. But there's no real advice on how to use that money wisely, and we don't work with the private sector, maybe supermarkets, to provide better food support with that money if that's what the beneficiary decides. We don't have to order people to eat healthy. We have to make it easier for them to be healthy. Even exercising a few minutes a day will have a massive impact. There are people in the audience behind me who've done some of the pioneering work showing lifestyle reverses things like heart disease.
Yes.
The fact that medications are at times useful, but sometimes not, for problems like heart disease and even Alzheimer's, where there was a large study recently showing that you could arrest the progression of disease. This is wonderful.
Doctor, I'll be chairing the Health Subcommittee on this committee, the Senate Finance Committee, over the next couple of years. So I look forward to working with you on some of those priorities so that we can make people healthier again, certainly creating an atmosphere in which people can make themselves healthier. I don't have a lot of time here, so I'm going to run through some things. Innovation in healthcare strikes me as one of the most obvious ways for us to bend the proverbial cost curve down and help make people healthier. One of the things that I've emphasized is the importance of getting faster coverage through the FDA for emerging technologies. I had some legislation on this over the last couple of years here in Congress. Will you commit to working with me on this issue should you be confirmed?
Senator Young, yes. Indiana is a hotbed for devices, and I feel strongly about making sure Americans get the best care.
Next quick thing, artificial intelligence. Can you give me 20 seconds, if confirmed, how are you going to ensure that CMS's policies and programs foster an environment that encourages adoption and full utilization of this amazing potential technologies coming online?
Senator Young, the folks who are desirous of bringing AI into the mainstream foundation of public health in this country need CMS as a partner. We have to make it easy to get the high-quality data in a protected fashion if beneficiaries desire it. If we provide it, they will build it.
Last thing, thank you. I have emphasized in recent years that every committee of Congress ought to be a national security committee. Believe it or not, the healthcare portfolio is now a national security portfolio. We have China stealing our intellectual property and leveraging health technologies for their war fighters. And so I would just encourage you, because I believe you're going to be confirmed, I think we'll have an opportunity to work together to also periodically reflect on the important national security implications of your post. And I thank you very much and your family for your desire to serve in this capacity.